Ever wondered what exactly is a splint? Well, you're in the right place. A splint is a medical device designed to support and immobilize an injured body part. Think of it as a protective barrier that shields the injury from further damage while providing the stability it needs to heal. The beauty of splints is their flexibility. Unlike casts, which are rigid and unchangeable, splints can be adjusted or removed entirely. This is great news for the healing process, as it allows for more freedom and adaptability as the injury improves. Splints come in two main types: rigid and flexible. Rigid splints, fashioned from robust materials like plaster or fiberglass, provide firm support, while flexible splints made from softer substances like foam or fabric offer a gentler touch. And it doesn't stop there. You'll also find custom-made splints, tailor-made for unique injuries, and ready-made splints, available for quick purchase and application. Splints are the go-to treatment for a range of common injuries, including fractures, sprains, strains, and dislocations. They deliver a triple whammy of benefits: pain relief, immobilization of the injured area, and protection against further injury. But remember, splints are not a cure-all. They do have limitations, such as a limited range of motion and an inability to provide complete stability. The application of a splint is a step-by-step process that involves assessing the injury, cleaning the area, padding the splint, and securing it with bandages or straps. It's crucial to follow the correct techniques to ensure the splint offers the right alignment and support. Once the splint is in place, it's time to take care of it. This includes keeping it clean and dry, avoiding getting it wet, and applying creams to soothe any itching or irritation. And let's not forget the importance of maintaining muscle strength through exercises recommended by a healthcare professional. In some cases, signs such as increased pain or swelling, changes in color or sensation, or difficulty moving fingers or toes may indicate that it's time to seek medical attention. In severe cases, immediate help is necessary. Understanding the basic elements of splints lays the foundation for the next steps. So let's continue our journey to learn more about the world of splints. Now that we know what a splint is, how does one apply it? Let's dive into the step-by-step process of applying a splint. The first step is to assess the injury. This involves determining the type and severity of the injury, as well as the location and position of the injured body part. It's crucial to take note of any signs of severe injury such as deformity, severe pain, or loss of function. Once the injury has been assessed, the next step is to clean the area. This helps prevent infection and promotes healing. It's important to use mild soap and water, and avoid harsh chemicals or substances that could irritate the skin. The third step involves padding the splint. Padding helps to cushion the injured area and prevent pressure sores. It also provides extra comfort and support. The padding should be applied evenly and extend beyond the edges of the splint. Securing the splint is the final step. This can be done using bandages, straps, or medical tape. The splint should be secured firmly but not too tightly, as this could restrict blood flow and cause further damage. The injured body part should be immobilized, but the patient should still be able to wiggle their fingers or toes. The importance of correct application techniques cannot be overstated. Incorrect application can lead to complications such as reduced blood flow, nerve damage, and delayed healing. So it's crucial to follow these steps carefully and seek professional help if unsure. In some cases, you may need to adjust the splint as the swelling decreases, or if the patient experiences discomfort. This is where the flexibility of splints comes in handy, as they can be easily adjusted to accommodate changes during the healing process. Remember, the main goal of a splint is to immobilize and support the injured area, relieve pain, and prevent further injury. So the splint should be comfortable, provide adequate support, and allow for some movement of the fingers or toes. Following these steps will ensure proper alignment and support. Splints require care too, but how exactly do we take care of them? Just as you would tend to a garden, caring for a splint involves regular maintenance to ensure it serves its purpose effectively. To start with, cleanliness is paramount. It's crucial to keep your splint as clean and dry as possible. This might sound like a daunting task, especially when you're in the midst of your daily activities. However, it's as simple as avoiding muddy areas and being careful when eating or drinking around your splint. You might be wondering, what if the splint gets wet? That's a good question. It's best to avoid getting your splint wet, especially if it's made of materials like plaster. If you're about to take a shower, consider using a waterproof cover to protect your splint. If your splint does get wet, dry it as quickly and thoroughly as possible. If it stays damp, it could lead to skin irritation or even an unpleasant odor. Speaking of skin irritation, it's not uncommon to experience itching or discomfort under your splint. To alleviate this, you might be tempted to stick a pen or a hanger down there to scratch. But resist the urge. This could lead to skin injuries or infection. Instead, try applying a lotion or cream, but be careful not to get the splint wet. Another aspect of splint care involves maintaining muscle strength. You might think that having a splint means you're off the hook when it comes to exercise, but that's not entirely true. While you should avoid strenuous activities that could aggravate your injury, it's important to keep the muscles around your injured area active. This can be done through simple exercises recommended by your healthcare professional. These exercises not only help maintain muscle strength, but also promote blood circulation, which is key to healing. In conclusion, taking care of your splint isn't rocket science. It's about being mindful of cleanliness, keeping it dry, managing discomfort properly, and keeping your muscles active. Remember, taking care of your splint is as crucial as the application process. Sometimes things might not go as smoothly as expected. When should one seek medical help? This is a critical question to ponder when using a splint. While splints are designed to aid in the healing process, there are situations where they may cause discomfort or even worsen the condition. Knowing when to seek medical attention is crucial in these circumstances. Let's talk about some of the signs that may indicate a need for medical attention. First off, if you notice an increase in pain or swelling around the splinted area, it's a clear sign that something might be amiss. Pain is your body's way of signaling that there is a problem. So, if the pain intensifies or persists even with the splint in place, it's time to consult a healthcare professional. Next, changes in color or sensation in the area around the splint can also be cause for concern. If the skin turns blue or white, or if you experience numbness, tingling, or a loss of sensation, these could indicate a disruption in blood flow or nerve function. This is a serious condition that requires immediate medical attention. Similarly, if you're having difficulty moving your fingers or toes, it could be a sign that the splint is too tight or not properly aligned. This can interfere with the healing process and cause further damage to the injury. In severe cases, such as experiencing extreme pain, inability to move the affected area, or loss of function, it's important to seek immediate help. These situations could indicate serious complications, like a severe nerve injury or even the onset of compartment syndrome, a dangerous condition where increased pressure within the splinted area can lead to tissue damage. Remember, the goal of a splint is to support healing and provide comfort. If it's causing discomfort or worsening the condition, it's not serving its purpose. So don't hesitate to seek medical advice when needed. Recognizing these signs early is key to avoiding further complications. Like any medical intervention, using a splint can have complications. What could these be? Well, complications can arise from an array of issues. One common problem can be bone movement within the splint. This can lead to malalignment or delay the healing process. Skin irritation or breakdown could also occur due to pressure or friction from the splint. Let's not forget about joint stiffness, which can result from a lack of movement. This is why it's crucial to follow any exercise recommendations from your healthcare professional. Accidental burns from hot objects or heating pads placed near the splint can also present a problem. More serious complications can include neurovascular injury. This affects both blood flow and nerve function, potentially leading to serious consequences. In rare cases, compartment syndrome might occur. This is when increased pressure within the splinted area leads to tissue damage. Being aware of these potential complications can help you navigate your healing journey with caution and care.